Hey guys, this is Dr. Allen from Reed Physical Therapy, and today I want to talk about how physical therapy can work to treat your headaches, more specifically your cervicogenic headaches. And what these are headaches that originate due to dysfunction through the cervical spine. So by that is the lower kind of upper portion of your neck, kind of this whole area right here. If you have any tightness in the area, caused by whatever reason. Some of us are students stressed out at school, or some of us work jobs where we have to sit a lot of the time. So maybe we sit with poor posture, or maybe we have to do a lot of lifting overhead. Whatever the case is, if we develop tightness in the muscles around our neck, then we're at risk of developing joint stiffness, just abnormal movements and coordination, maybe a little bit of swelling in the area of our neck that can contribute to pressure on the nerves that radiate up into our head, which can then contribute to headaches. So those are just a few examples, but regardless of why you're having headaches, physical therapists are specially trained in this area to reduce them. So there's plenty of techniques, starting with hands-on techniques to massage muscles, effleurage to flush any swelling out of the area, ways to reduce tension in those muscles, kind of get knots out of your shoulders, things like that. And then the use of modalities like ultrasound or dry needling are pretty effective in aiding hands-on techniques to improve mobility with your neck and reduce tension. There's a few more things that your therapist should be doing, like joint mobilizations to relieve stiffness in those joints. And then after that, some stretches, corrective postural exercises, things like that to create stability throughout your neck. And so the main point of this video was to let you know that physical therapists can treat your headaches. I think a lot of the times medication or some sort of injection, something like that, is the first line of treatment when it comes to headaches. The truth is, though, physical therapy can be very effective and is often less invasive, less painful, obviously, and much more effective. So if you're suffering from headaches, it's always a good idea to get it checked out by your physical therapist, to give them a chance to work on you and see if they can't